when John noticed that his coworker Adam was repeatedly showing up late to work, missing deadlines, and sometimes isolating himself. The last thing John wanted to do was to offend a fellow employee, but he couldn't help but be concerned for Adam and his other team members who were suffering because of Adam's missteps. So one day, as Adam was napping at his desk, John walked to his cubicle to check on him. John told Adam that a few people, himself included, noticed changes in his behavior. After telling him this, John asked Adam a question no one had asked him in quite some time. "Are you okay?" Initially, Adam wanted to lie. However, he decided against it and was honest with himself and another person for the first time in a long time. While talking to John, he revealed that his depression and substance abuse have worsened in the last couple of months as he's experienced a death in the family. He thought he could keep his work and personal life separate, but there's been some spillover, which John had noticed. After letting John know what was going on, Adam was eager to hear if John had any advice. And luckily, he did. John told Adam he knew of a grief support group that a friend had joined years ago. After taking John's advice and attending the support group consistently, Adam is visibly happier and back on track at work. If you thought a coworker was struggling, would you intervene? The truth is, not many of us would. However, as John and Adam's story depicts, this hesitance is worth reconsidering. Thus far, our discussions have mainly centered around how employers and supervisors can support their employees with mental health disorders. What should happen if you're in a different position, such as a coworker willing to extend help, or an employee in crisis? Like John in the opening example, you want to be respectful, but point out what you've noticed in their behavior lately. Be specific while trying to avoid judgment and jumping to conclusions. There may be a time when a coworker explicitly asks for your input or assistance in coping with their mental health struggles. Listen carefully to your coworker's disclosure and resist offering unsolicited advice unless it's asked for. Here, the goal is to have a supportive conversation that lets your coworker know that you care about their well-being. However, as you're not a therapist, your coworker may require additional assistance, such as professional help or community resources. Let them know that these external avenues are a good idea. Importantly, if they don't have immediate luck, reassure them that others are available, so they should keep looking until they find a good match. Given that mental health issues are often persistent and fluctuating, this openness between team members ensures that you can count on each other for support when needed. As a result of these actions, you and your coworker may have a much better workplace relationship. Research what resources your employer already has available. If you choose to have a one-on-one conversation, understand that it may be difficult. However, you don't have to disclose anything you don't want to. By collaborating with your supervisor or the HR team on mental health strategies at Jack Cooper, you advocate for yourself and others who may not be ready to speak up. At the same time, you're proving that individuals with mental health challenges aren't unusual or incapacitated, as many believe. Your courage demonstrates quite the opposite. Individuals with mental health difficulties, diagnosed and undiagnosed, can thrive in the workplace because of their grit and resilience.